Great, thank you very much. And just to echo Professor Kavanagh, it's really nice to see so many people here this evening. And I think it is a really good endeavour, so well done for setting it up. So as Amit said, my name is Julie Langan-Martin. I'm a clinical senior lecturer in psychiatry at the university and an honorary general adult psychiatrist. So what I was going to do tonight was take a bit more of a personal kind of story and tell you a bit about my background, my journey to where I am and my research interests along the way, just to give you a bit of a kind of tour of that. So I started medical school in 2002. I went to the University of Glasgow, did a variety of SSCs because I really wasn't sure what I wanted to do going through medical school. So I did lots of different things like radiology, pharmacology, sports medicine, medical ethics, did my electives in various different things like A&E, and then I did pediatrics. And then after I graduated, I really wasn't sure what I wanted to do, but I probably thought I wanted to do medicine or radiology. So I applied for for my foundation year training at the West of Scotland, and I got a post. Year one was in the Royal, and I did medicine surgery, and I worked in the professorial unit, the stroke unit, and worked in the diabetic unit. And at that point, I got interested in research because there was a number of unusual presentations, particularly when I was working in the Royal, and I was able to write my first case report. And I really thought at this point, I wanted to go into metabolic medicine. I wanted to be a diabetologist or something like that. But as they do, they changed the jobs for FY2. So I had wanted to do a metabolic medicine job, but that wasn't available. And the other jobs that I wanted to do were care of the elderly medicine and A&E. And it was either going to be psychiatry or orthopedics was the third job in that choice. And I thought, well, I didn't really at all want to be an orthopedic surgeon. So I thought, let's go for psychiatry. And actually, it was a really big change in my thinking, and obviously has hugely affected my career, because actually that first job as an FY2 in psychiatry was really excellent. And it really opened my eyes to the field of research, because I was lucky that I had an education supervisor who was really interested in research. He was interested in antipsychotic polypharmacy, but I was interested in the physical health of people with major mental illness, because, you know, when I was in the psychiatric wards, what really struck me was why on earth did everybody have so many medical problems? And because I was still thinking about doing medicine, I thought, here we go, I can definitely do something here, thinking about the physical health of people with psychiatric illness. And during the time of my foundation 2 job in psychiatry, you have, well, I had time to think, time to do research, time to explore these interests. And that led to another publication with, you know, driven by my educational supervisor's kind of interest in polypharmacy. And I ended up doing a good audit, thinking about physical examination in people who are admitted to psychiatric hospital. And I won a prize for that. So then I was hit with a big decision. What did I do? Did I do core medical training or did I do psychiatry? And it was a real dilemma. And obviously I did psychiatry. But I think, and as Jonathan's highlighted, there's lots of medicine in psychiatry and there's lots of opportunity to do lots of different research. So I started core training. I did my MRCP because I still thought I might become a medic. I still really liked medicine. I still liked looking at people's physical health. And I did obviously my membership in psychiatry and got involved in lots of local projects and areas of kind of interest to me as well. So still thinking about physical health and polypharmacy. I was able to present lots of different kind of audits and research projects all over the world, literally. So I was able to go to Philadelphia to present stuff at the APA. I was able to go to Salzburg to present stuff at the European Congress as well, and was able to do research where I was initially kind of low-level projects, thinking about using different types of antidepressants, so agomelatine, and then also thinking about teratogenic risk and our advice about contraception for people that were prescribed anticonvulsants. So slowly working, doing little projects and building up a CV and things like that. Then I was able to apply for a clinical lecturer post, and that was when my real kind of research interest began to develop. So I was able to get some funding to go out of programme and register for a higher degree and able to focus on my interest about physical health in people with mental illness, thinking about multimorbidity and able to do data linkage projects using large data sets. So I was able to get access to data from the UK Quality Outcome Framework, the QOF, and was able to look at health inequalities for people that had physical illness, but also had, you know, severe and enduring mental illness like bipolar disorder and schizophrenia. Because for those of you that perhaps don't know, people with bipolar disorder and schizophrenia die prematurely, and it's often between 15 and 20 years compared to people without major mental illness. And it's not that they're dying from suicide, it's other things like cardiovascular disease, hypertension, all sorts of other physical health comorbidities. So it was a really important project to be able to do. I'm also interested in perinatal mental illness as well, because during my higher training, I worked in the West of Scotland Mother and Baby Unit and was able to do some research thinking about why are women in this postnatal period so at risk of developing mental health problems. And at that point as well, I got involved in teaching, initially teaching on the Global Mental Health Masters programme, and then being involved in undergraduate medical school curriculum because we were recognising that psychiatry was underrepresented within the undergraduate medical school curriculum. Certainly at Glasgow University, it is getting better, but I think you probably agree that there's more that could be done in that regard. So during my higher training, I was able to finish my higher degree. I completed a Masters in Education as well, and obviously finished clinical training. And then in November 2016, I was lucky enough to be appointed as a senior lecturer and working as a consultant psychiatrist. And my research interests continue, but they still are relatively broad, still interested in multimorbidity, health inequalities, perinatal mental illness. I'm also interested in ECT because that's what I do clinically. I'm involved in delivering ECT for people that have severe and life-threatening illnesses. So I'm involved in an ECT genetic study, and suicide prevention is another area of interest of mine. And also because of my teaching role, I'm interested in stigma and burnout, thinking about why do potentially junior doctors have bad attitudes to psychiatric patients, and unfortunately we know that's true. And I'm also interested in some of the research within teaching, so things like alternative assessments and graduate attributes. So hopefully that's given you a bit of a whirlwind bit about my background, the journey to where I am, and my current research interest. But I think the key points is that even if you don't know what you want to do, that's fine, because the journey will take you, I think, where you're meant to be. And I think having a wide variety of interests at an early stage, I think, is really important. So hopefully that's still on time, and thank you very much for listening.